Hello, I'm Alex Christensen. I'm a lieutenant paramedic at Lacey Fire District 3. I've worked for this community for 25 years. Today I'm going to show you Medic 3. I think it's the most important rig in our fleet. We're going to go through it and show you what it does. This is Medic 3. This is one of 3 ALS rigs that work for Lacey Fire District 3. ALS is Advanced Life Support, and that's staffed with 2 paramedic firefighters. All of our other engines, trucks, battalion rigs are staffed with EMT firefighters. So this rig has a little bit different equipment, and it primarily takes care of advanced life support medical calls. Now we get to take a look. First compartment here on Medic 3, we have our drug box and LifePak 15 cardiac monitor. This is what we would take in for most of our ALS acute medical calls. Okay, so all of our units are multi-purpose. All of them carry equipment for fighting fires, rescues, and also medical calls. Back here you can see we have backboards. We also have our bunker gear and SCBAs in case we are near a fire. We'll go to that as well. So as we come around back here, we have more bunker gear. There is 2 firefighter paramedics on these rigs. We also have an additional SCBA and a special lifting device called a stair chair to get people down from multiple stories. So in this compartment we have some additional technical rescue gear. Right here we have rapid entry rescue swimmer gear. Throughout our department, many of our members are trained for rapid entry rescue swimming. That's subsurface rescue of a victim, and we carry the equipment with us so that whenever the emergency goes, we would just leave to it from wherever we're at. We also have what's called an over-the-hill bag. That's in case the medical emergency is over the hill, through the woods, down the embankment. We can carry some medical equipment with us to the patient, start treatment. Meanwhile, the rest of our teams will work on a plan on getting the patient out of that scenario. We also have an MCI kit. That's a mass casualty incident, and that is for when there's a medical incident like a multiple vehicle car wreck, if perhaps a train would crash on the freeway. That's many patients that overwhelms our system. We can start setting up for a hour-long, day-long process of removing patients and getting them the care they need. Now we're going to show you the back of the medic unit. We're going to start by showing you our power gurney. It is hydraulic, battery operated. It will allow us to hold 700-pound patient. We also have oxygen attached to this and some other medical supplies if we need them. Alright, so now we're in the back of Medic 3. This rig was specifically designed with room so that responders can work around both sides and from the head of the patient. If you find yourself in the back of this rig, it's probably because you are having or could potentially have a life-threatening emergency. We take in cardiac patients, respiratory patients, stroke patients, trauma patients, occasionally diabetic patients, and we have all of the equipment here to provide that critical care that you would need in the first 10 to 20 minutes of your emergency. This is why it's so important in the event of potentially having a heart attack, a cardiac event, or a neurologic event like a stroke, that you call us early. In the case of the heart attack, we can start the same 3 or 4 treatments, medications, diagnostic work that the cardiologist would do were you in their office. We'll start it in the field, start it in the home, let the cath lab in the emergency room know, and start treatment right away. In the case of your heart, that saves heart muscle, which is pretty important to living. The same is true with a stroke. That call early, we can recognize, we have specific tests to do to diagnose in the field and stand up a stroke team at the hospital so that they're ready to receive you as we roll in. Back at Medic 3 again, and we're going to show you some equipment that we use often in the course of treating our most acutely ill patients. This is our IV tray. If we need to start an IV, give you fluids, this is everything we would need to do it. Next to it is a 1,000 cc bag of saline, that's the fluids. Next to that is an airway roll. If we need to put a tube down your throat and breathe for you, everything we need is there. Further down, we have our LifePak monitor. We can monitor your heart, do 12 lead EKGs, and defibrillate you if it's needed. Above that, we have some of the medications we would give you in those medical emergencies. That's the end of our tour of Medic 3. I really appreciate your time. We'll see you around town.